What are the main mechanisms of thrombosis formation? 1. What are the main mechanisms of thrombosis formation? Thrombosis formation is a multifactorial process resulting from the interaction of genetic and environmental factors. Clinically common characteristics in thrombotic patients include familial hereditary traits, recurrent episodes, severe symptoms, abnormal thrombus formation sites, and an increasing trend of onset at a younger age. Suspected arterial or venous thrombosis or thromboembolism requires objective evidence. Angiography is the reference standard for diagnosis, but ultrasound performed with proficient techniques can also be used to examine superficial vessels and the heart. When the endothelium is damaged, endothelial cells degenerate, die, and detach, exposing subendothelial collagen fibers, which activates factor 12 of the intrinsic coagulation system, leading to the activation of the intrinsic coagulation pathway. In patients with proven spontaneous deep vein thrombosis by venography, 25% to 50% of cases have a genetic predisposition. When there is a congenital defect in the anticoagulation mechanism, e.g., factor V Leiden, hyperhomocystinemia, protein C deficiency, protein S deficiency, antithrombin deficiency, impaired fibrinolytic function, combined with a thrombotic stimulus, e.g., surgery, pregnancy, oral contraceptives, antiphospholipid antibodies, venous thromboembolism is likely to occur. Patients with multiple site thrombosis in the early stages have significantly higher frequency and severity of episodes compared to those with a single thrombus. 2. Methods to prevent thrombosis formation. Participate in physical activities. Exercise can promote blood circulation, thin the blood, and reduce its viscosity. Activities such as Tai Chi, gymnastics, dancing, cycling, jogging, swimming, and sword dancing are beneficial. Increase high-density lipoprotein, HDL. HDL does not deposit on blood vessel walls and can promote the dissolution of very low-density lipoprotein, VLDL, already deposited on the vessel walls, ensuring smooth blood flow and preventing arteriosclerosis. Exercise and dietary adjustments can increase HDL levels. Foods such as onions, garlic, chili peppers, green beans, spinach, cucumbers, carrots, apples, and grapes are recommended. Medication prevention. Taking a small amount of aspirin as prescribed by a doctor can acetylate platelet cyclooxygenase and deactivate it, preventing thrombosis formation. However, high doses inhibit the production of prostacyclin I2, accelerating blood coagulation and causing thrombosis. Therefore, high doses are not recommended. Compound Danshin tablets, taken 3 times a day with 3 tablets each time, have the effect of promoting blood circulation and preventing thrombosis. Drink water before bedtime. Drinking a glass of water before bed can prevent thrombosis. Developing a habit of drinking water daily, 1,200 ml per day, helps improve blood circulation and reduces blood viscosity, which is beneficial for thrombosis prevention. Eat more of the following foods: onions, kelp, cabbage, deep-sea fish oil, black fungus, chives, lettuce, and moderate amounts of vinegar and tea. 3. Types of antithrombotic drugs. Anticoagulants. These are drugs that interfere with clotting factors to prevent blood clotting. They are primarily used for the prevention and treatment of thromboembolic diseases. Antiplatelet drugs. These are divided into 3 generations: aspirin, first generation, ticlopidine, second generation, and platelet glycoprotein IIB, IA receptor antagonists, third generation. The introduction of platelet glycoprotein IIB, IA receptor antagonists is a significant milestone in antiplatelet therapy. Fibrinolytic drugs. These activate plasminogen to promote fibrinolysis, which dissolves fibrin formed during coagulation, thereby dissolving thrombi. These drugs are also known as thrombolytic drugs and are used to treat acute thromboembolic diseases. First-generation thrombolytic drugs, such as streptokinase, SK, and urokinase, UK, are still widely used. With the emergence of new generation thrombolytic drugs such as pro-urokinase, pro-UK, These medications are gradually being promoted in clinical practice. 4. Types of thrombosis. White thrombus occurs in areas of rapid blood flow, e.g., arteries, ventricles, or during periods of rapid blood flow during thrombosis formation, e.g., the initial part of a mixed thrombus in a vein, also known as the head of a propagating thrombus. Microscopically, white thrombus is mainly composed of many coral-like platelet trabeculae, with numerous adhered neutrophils on its surface forming a leukocyte margin layer, attracted by fibrin degradation products. Fibrin meshes form between the platelet trabeculae, containing a small number of red blood cells. Macroscopically, it appears gray-white, rough, with ripples, firm, and tightly attached to the vessel wall. Mixed thrombus. The main part, body, of a continuous thrombus in a vein shows alternating red and white layers, which is a mixed thrombus. The formation process involves the continuous growth of a platelet-based thrombus, causing downstream blood flow to form a vortex, thereby forming another platelet-based thrombus. The blood between these two thrombi then coagulates, forming a red blood cell-based thrombus. This alternation results in a mixed thrombus. In mitral stenosis and atrial fibrillation, a ball thrombus can form in the left atrium, showing alternating gray-white and reddish-brown layered structures, known as a layered thrombus, which is also a type of mixed thrombus. Red thrombus occurs when blood flow is extremely slow or stops altogether. Its formation process is similar to that of extravascular coagulation. Thus, red thrombi are found when mixed thrombi obstruct the vessel lumen, leading to local blood flow cessation, often forming the tail of a continuous thrombus. Microscopically, the fibrin meshes are filled with blood cells distributed like normal blood. Macroscopically, it appears dark red. Fresh red thrombi are moist and somewhat elastic, while old red thrombi become dry, brittle, lose elasticity, and are prone to detachment, causing embolism. Hyaline thrombus. This thrombus occurs in microcirculatory vessels and can only be seen under a microscope. Therefore, it is also called a microthrombus. It is mainly composed of fibrin and is seen in disseminated intravascular coagulation, DIC. 4.0.